Hello, it's Kerry again. Sorry it's been so long updating. I've had a bit of a crazy few weeks. But I'm here today to talk about diagnosis and outlook on the medical system. Well, my diagnosis was only recent, really, but I'd always known that there was something different about me from when I was quite young. I would get I couldn't really deal with stress that well from sort of teen years, so kind of 16, 17. I was very bad at dealing with stress, particularly relationship stress or arguments. I would get quite hysterical at times. And yeah, I thought I was just a really sort of slightly unhinged person. And this carried on in most of my relationships, I would say. And it got to the point where I would sort of physically lash out. I would be quite violent in arguments. I've never really hurt anyone properly, but I have lashed out with my hands, thrown things before, and I started thinking maybe I was just a horrible, violent person. I had counselling. I've been on and off of medication. When I used to go into the doctors and talk about it, they would say, right, we'll put you in for counselling, and I'd have some counselling. I'd feel a little bit better, but it wouldn't really help. And they put me on medication, and then a year later I would try to come off the medication with their sort of supervising, and I would come off it. I'd be okay for a little bit, and then it would just happen again. But I didn't really notice the pattern of when the symptoms were happening quite a long time. So it was earlier this year. I was with someone who I hadn't been with for very long, but I started to notice, I don't know, just I would be really, really fine for a period of time, and then I would be incredibly not fine. So I started writing down symptoms and when they happened. And I found that after a few months, that they were happening in exactly the same cycle, and it was starting, 7 to 10 days before my period, and then a couple of days into it, it was subsiding completely, and I was having a week where I was sometimes even close to being manically happy because of the contrast and the relief. I think there were times when I was sort of babbling my words and, kind of like in a manic depressive, bipolar kind of way. So I ended up looking up my symptoms online, and then a page on PMDD came up, and it was like my life basically spelled out on a page. Even though I'd been to the doctor so many times, I'd caused harm to myself. I've got 4 scars on my leg, where I've hurt myself. Even after all of that and going to many, many different doctors and asking what was wrong with me, they could never really tell me. So I had to do it myself. And I don't think that's an uncommon story with people that suffer from PMDD. But in the end, I saw this page on the internet and I was like, that is my life on a page. And I went back to the doctors. I went to see a female doctor who was better. And I said to her, look, I'm having all these symptoms. I've looked up this. What do you think? And she sort of said, oh yeah, I suppose it could be that actually. Sort of in a, she would never use the term PMDD because I don't feel like it's a term that doctors use or a lot of doctors use. It seemed like she wanted to say severe PMT, whereas, I know anyone who suffers from it knows that it's not severe PMT or PMS or whatever you'd call it. It's a totally different beast. So at that point, I sort of said to her, you know, that I've seen that there's this treatment and that treatment for it. I said, what would you suggest starting me on doing, because I can't live like this anymore. And she said, you know, to start on an anti-anxiety medication, see how that works. And it does take the edge off of the symptoms for me personally. I mean, it means that I don't seem to descend into that sort of complete hysteria or rage that I was before. It keeps me rational enough to know that I'm in it and that it will pass. Whereas before, I was so caught up in the whole situation that I just thought that what I was thinking was the truth, and that I did hate my life, and that I did want to die, and I hated everyone in my life, and, you know, all of those things. I believed that they were true. Whereas now, with the medication, I can kind of keep a slight rational voice in my head saying, this is awful right now and you feel terrible, but this will pass. And that doesn't mean that it makes it any easier. Some months it's so bad that it's still really bad, but at least I know I can get through it, and I know that I'll get to the other side of it, and that there will be a good week. I came off the pill and had a coil fitted when I had a problem with my ovary last year. But I read online that it's worth trying a low level dosage of the pill to see if that will help with symptoms. So I thought, you know what, I don't really like the pill. I don't like taking hormones, because obviously I'm essentially allergic to my own hormones. But I thought, if there's a chance of me going through a bit of crap for a bit and it actually helping, then I'm willing to take that risk. I know a lot of women don't agree and they won't go on the pill because they think it's just adding insult to injury, but for me it's an option, and I want to try everything I possibly can. So I've been back to the doctors about a week and a half ago, and she's put me on Mercilon, which is a really low level dosage of the pill, progesterone pill, and I felt rubbish for a week, but she said I might feel rubbish for 3 months, but that I can link the packets together and maybe not have quite so many PMDD attacks or episodes or whatever you want to call them. So I'm willing to try it and see what happens, because at the end of the day, even if it doesn't, or if it makes me worse or whatever, at least I've tried it, and I know that it won't work then for me. But it might do, you know, it might be that I string 3 packets together, I don't have any symptoms for 3 months, and then I have 1 month where I have terrible symptoms, but that still means that I can function 3 times as much in my life. Whereas at the moment, I have 1 good week, and then, one good week out of every 3.5 weeks. So out of every 4 weeks, 1 good week out of every 4 weeks, essentially. And my cycle is like 19 days, so it feels like it never ends, basically. And some months it doesn't. Some months it does carry on and it overlaps. So we'll have to see what happens. But with regards to my opinion on the medical system, they just don't seem to be informed. They don't seem to. I had to do all my own diagnosis. I had to suggest my own treatment. I had to do basically all of it. And if I hadn't have done, then this would never have been picked up. But it is obviously that, because I have pretty much every symptom on the list. Like 99% of all symptoms, of all the like 25, 30 symptoms listed, I have them all. So it's, yeah. But we'll have to see what happens anyway. But I hope that made some sort of sense, because I'm not feeling very good at talking today. But yeah, thank you.